Hi, I'm Matt.
I'm Lauren.
And I'm Jessica.
Our group was asked to present on the ankle and foot, and we chose a second-degree high ankle sprain as our injury of choice.
A high ankle sprain is an injury to the syndesmotic ligaments that hold the tibia and fibula together. So that includes the anterior inferior tibiofibular ligament and the posterior inferior tibiofibular ligament. In this model, we are able to see the anatomical positioning of these two ligaments. High ankle sprains, also called syndesmosis sprains, can cause a significant amount of dysfunction. The syndesmotic ligaments help to stabilize the tibia and the fibula. A high ankle sprain is often caused by an inward or outward rotational force on the foot. These sprains are higher up on the leg than regular lateral ankle sprains and usually take twice as long to recover from.
So our first exercise is the alphabet exercise. The purpose is to increase the range of motion of the ankle, and this would be done during the early proliferation phase of healing. To perform this exercise, the ankle is brought through a variety of different movements, such as eversion, inversion, plantar flexion, dorsiflexion, and ankle circumduction. So this exercise can be performed either sitting on a chair with your feet elevated off the ground, or lying on a table with the foot hanging over the edge of the table. Once the patient is in proper position, with the foot hanging over the edge of the table, the patient will then use the big toe to spell out each letter of the alphabet. This is a simple exercise that can be done by the patient independently, anywhere and at any time, such as at home or during travels. The total number of reps for this exercise should be the length of the alphabet, from A to Z. They will perform this for 2 sets, and this should be done 3 times a day, every day. Expected sensations that the patient should be informed of is that they shouldn't feel any pain during any of the movements. It might feel stiff if there's still swelling in the ankle. Some precautions and contraindications that the physical therapist should take into consideration is when the patient is immobilized, such as in a cast, any fractures or infections, acute inflammation, such as the initial swelling period of injury, and any extreme pain with movement.
So the second exercise we've decided to do is our strengthening exercise. And these are strengthening exercises that involve elastic bands as resistance. So the purpose of these exercises is to strengthen the muscles and the ligaments in the ankle and the foot. And so lighter resistance bands can be used as resistance during the late proliferation phase of healing, once full range of motion has been restored by doing range of motion exercises. And the heavier resistance bands can be used more in the remodeling phase, once strength is a little bit stronger and range of motion is again fully restored. So to perform this exercise, the patient should be sitting on a table with their foot hanging off the edge of the table. The band should be positioned in the middle of the foot, not up by the toes or down by the heel, and with the physiotherapist standing out to the side. To practice the muscles that invert the ankle, the therapist will hold the elastic band out to the side at an appropriate resistance, and the patient will invert their ankle, bringing the sole of the foot towards the midline of the body. They will hold for 1 or 2 seconds and then release. Make sure that the motion comes strictly from the ankle and not from the knees or the hips. To improve the strength of the muscles that evert the ankle, the patient will stand towards the midline of the body and hold the elastic band at an appropriate resistance again. The patient will then evert the ankle, bringing the sole of the foot towards the outside of the body. Again, making sure that the motion comes strictly from the ankle. To improve the muscles that dorsiflex the foot, the therapist will hold the band out in the front of the patient and hold it like so. The patient will then dorsiflex their foot, bringing their toes towards their body, holding the position for 1 or 2 seconds and releasing. To improve the muscles that plantar flex the foot, the patient will hold their own elastic band and hold it like so. They will then practice plantar flexing their foot by bringing their toes towards the ground, holding for 1 or 2 seconds, and then releasing. There are many different types of elastic bands you can use to perform these exercises, dependent upon the patient's initial strength and equipment available. Once the patient has learned the correct technique, they can perform these exercises anywhere without the presence of the therapist by attaching the elastic band to a table or chair. These exercises should be done by doing 2 sets of 10 repetitions in each of the 4 directions. These exercises should be done at least 3 times a week or every other day. The patient is able to move on to proprioceptive exercises, which include agility, balance, and coordination once their full strength has been restored. So some precautions and contraindications to be aware of is making sure that the band is securely tightened around the middle of the foot so it doesn't fly off and hit anybody. And if the patient does not have full range of motion, do not perform these exercises, as well as stopping if they have extreme pain.
The third exercise that we chose to do to treat a grade 2 high ankle sprain is a ladder agility exercise. So this is to improve agility of the ankle and to practice motions that are sport specific, such as stopping and starting and moving laterally. This exercise would be carried out in the later remodeling phase once the patient has full range of motion, flexibility, balance, coordination, and strength. So the patient will start at the end of the ladder and will progress through the ladder with their positioning depending on the exercise. And they need to make sure that they keep on the balls of their feet throughout the exercises. The exercises will start off simple and slow. For example, the patient will run through the ladders with 1 foot in each square. This exercise can be progressed by increasing speed and complexity. For example, a next progression could be moving through the ladder quickly with 2 feet in each square. The next progression is inside-outside hops, where the patient jumps inside and outside of the ladder. Once the patient has mastered this, they can increase the speed. The next progression is where the patient moves laterally through the squares. And once they're comfortable with this form, they can increase their speed. The last progression is a complex combination of both lateral and forward movements. Once the patient has mastered this technique, they can also increase their speed to increase the complexity. So the patient should do 5 to 7 of these exercises 3 times through the full ladder, and this should be done about 3 times a week. While they're doing these, they shouldn't feel any pain. They may be sore the next day or afterwards. And once they master each progression, they can move on to the next level. And then once they master all the agility levels, they can move on to more sport-specific exercises. The precautions and contraindications of this exercise are that it should not be performed if the patient's range of motion, flexibility, strength, balance, and coordination are not 100%. You also wouldn't carry this exercise out with people that have little or no agility training, for example, the elderly. Also make sure that the exercise is carried out at a speed that does not compromise the patient's form of the exercise.
Oh, hi there! You see number 21 that just scored? He suffered a high ankle sprain just 8 weeks ago, and by doing the exercises we prescribed to him, he was able to return to play, and is now playing in the Zones Championship. Go Comets!
So these exercises we've shown you will help bring a participant or injured athlete back to full capacity to play in sports. The end result for criteria should be no pain or swelling, full range of motion, strength, endurance, proprioception, agility, and coordination. The patient should feel confident in the injured part and perform all activities pain-free.
So we hope you enjoyed our video and learned a little bit about the benefits of therapeutic exercises in treating musculoskeletal injuries.